Brigadier General Dan Tully here, and today I brought my battle buddy, Chief Bruce.
Yeah, let's get it.
We're going to go back, answer some of the questions. In case you don't know, we've been running a poll everywhere survey to get a lot of input, and believe me, we've got pages of input from airmen already asking questions, and we're going to try and get to some of those. But just an overview of where we stand, there's still no cases of COVID-19 on Al Udeid Air Base. When we do have one, and I think it's a matter of when, not if, but at some point we'll probably have a case, we'll go ahead and tell you about that first case and how everything played out. We do want you to know that everything is working as advertised. All the preventive health measures we put in place seem to be working. But even with that, it's very likely, given the dynamic nature of our mission, we're going to have a case of COVID-19 at some point. So when we do, we'll talk about that first case, but after that, for operational security reasons, we won't talk about numbers and things along those lines. But you'll still be able to get all that information from your commanders as the need might arise. All right, so going through this list of questions here, what conditions would lead to Health Protection Condition 3 or more stringent measures? Will the 379th post things to YouTube to communicate to those without Facebook or social media? So yes, we will put stuff on Facebook and YouTube, but all different types of social media. But what conditions will lead to HPCon 3? We're taking a tiered approach. So if we saw cases of COVID-19 and then we saw an increase of cases of COVID-19, it depends on what we see on base and in the local community, right? So we're watching that every day. We have a dashboard, and twice a day we're meeting the wing leadership team to track the cases. Right now, Qatar they haven't gotten more than 500 cases, and they've been relatively flat in terms of the number of new cases. But we're going to keep our eye on that and a couple of other things going forward. What capabilities does the clinic have? And this individual gets into all sorts of questions. What blood tests are we capable of performing? What's the supply status of said blood tests, etc.? I'll tell you this, rest assured our clinic has all the supplies that we need, and we've ordered some more just in case, and I have no concerns whatsoever about our posture and our readiness to handle whatever might come. So I feel like we're in very capable hands. Respirators, everything. And if something should happen and our clinic should run out or we'd run into difficulties, the hospitals available to us downtown in Doha are some of the best in the world. The Qataris spare no expense for their health care, and we're one of the beneficiaries of that. All right, Chief. Some of these mitigation responses are disproportionate, especially considering how especially stressing this is while on deployment away from family. So, in general, we're getting a number of questions about balance and is this measure okay when we're doing this one? What do you think about that?
I think we're trying to take a measured approach, and we're being more creative. So let's say for church, for instance, we're broadcasting on AUAB Victory Chapel on YouTube. So if you subscribe to that, the Catholic service as well as both contemporary and the gospel services are being live streamed. We're trying to be more creative in cutting down our social gatherings.
And something else that we've noticed, so we put in place these force health protection measures, and then we've taken a look to see how they're going down and how that's playing out. There's still a lot of places where some folks aren't ensuring the right social distance, or they're queuing up in lines and they're getting too close. And we can't be the police of that. That's not the intent here. It's a personal responsibility. So Chief and I will stress over and over again, take personal responsibility. Make sure you're practicing good hygiene, washing your hands, police each other, make sure you're 6 feet apart.
I know, right?
Unless you're doing mission critical work or essential stuff like getting the word out to airmen. You want to add anything there?
Yeah, it's all about being a good teammate. It goes back to service before self, sacrifice, all that good stuff. So when you go to the BX, and AAFES is working extremely hard to keep their stockpile up, but when folks are going in buying 10, 11 packs of toilet paper, buying all the bleach, I mean, let's think about your teammates. Think about your joint service partners, our coalition partners that are here that need those same supplies. So let's just take care of each other, man.
Yeah, buy what you need. Don't be buying stuff and sending it home and other stuff. We'll get to a question on that here in a second. All right, so here's a suggestion. There's no such thing as over-communication. Be transparent. Get input from the front line, so to speak, on whether the installation plans are actually functional, and a whole bunch of stuff is in this comment. So that's great input, right? We are doing our best to over-communicate. First thing we're doing is asking for feedback. We are constantly asking for it. So this feedback came to us from a Poll Everywhere survey that our public affairs team put out. They're going to send that link out, make sure that it works, whether you're using Internet Explorer or using Chrome, and hopefully it'll work on your mobile device. There's only 3 simple questions in there. Are you getting information? Where are you getting it from? And then what are your questions for us? And you can type as much as you want. We'll try and get you this information, get these answers as we have the daily updates. All right, are our supply chains here on AUAB affected? And if so, when? What are you planning to tell us? I can't help but notice that the PX has been out of coffee, toilet paper, and ramen noodles, and there's been no milk at the DFAX for some time. A couple of things in there. PX, I know you're a soldier, hooah. But our base exchange, separate issue from our supply lines. Our supply lines are not affected here on AUAB. Food, water, petroleum, oil, lubricants, all the critical things for our mission. No stopping to that stuff. It continues to march on uninterrupted. But when it comes to comfort stuff, like at the exchange, that's where we need your help. We do see some people are buying things, maybe toilet paper, and it might be getting shipped back home because there's a perception there's a shortage back home. Please don't do that. We are going to get after that. We're going to ask our postal inspectors to take a look and highlight to us if they're seeing any kind of activity like that. Because every package that gets shipped back home, you've got to open it up and get it inspected. The milk. What do you want to say about the milk?
The milk.
There's no shortage of it. We're buying the same amount we've always bought, and we actually have 1,000 fewer people on the installation than we did last month.
Yeah, the milk is perishable, so please just take 2. So once it's restocked, just take the 2 that you're allotted, and then go about your business. Please know, one of your teammates will call you out if you try to take more than 2 milks at a time. So just follow the directions on the refrigerator.
We're getting a lot of great comments, and so it's a good opportunity for Chief and I to pat our Med Group on the back. A lot of great comments about how organized their response has been. 1 or 2 people have had some questions, but by and large, people are pretty happy with the information they're getting from the Med Group and the guidance. If you're feeling sick or not so well, contact the Med Group. Follow the direction of the medical professionals, and they've got a whole system set up where they bring you in. There's a tent outside the Med Group that'll keep anybody who might be infected away from everybody else being seen for normal stuff or going to the dentist or the eye doctor, and then they'll work you through their process. And so you might end up in quarantine or in isolation at some point. All right. That's a long update, but you guys have a lot of questions. We'll get through the rest of these tomorrow and give you more feedback on what we're learning and what we're hearing. Big things, though. Question, when do I get to go home? I'm a guardsman or I'm a reservist. When do I get to go home, and is that going to be changed? That answer can still come from your squadron commander. Know that the Department of Defense is working through the Guard and Reserve question right now at this time. We're waiting to hear what their answer is. In general, there's a stop movement, but there are lots of exceptions, and there's plenty of other planned rotations and movements still occurring. So it's a little complicated, right? Just go see your squadron commander. He or she will make sure you get the information that applies to you. All right. Thanks for all you're doing. Thanks for your patience, and stay healthy, AUAB.